Asthma COPD outcome document.
What is asthma COPD outcome documentation?
This module will cover how to use ECW to document the note for a patient with asthma and COPD. We will cover sections that include the HPI and ordering PFTs.
Okay, let's start with HPI. What do I need to do if my patient has asthma or COPD?
In HPI, for asthma, you will document the patient's current assessment and symptoms annually by using the ACT score questions. You will then assign a score and rate the severity of their asthma. Let me show you. From your progress note, click on HPI. Under the Total Health category, select 3.0 Asthma. Click in the Notes field next to Assessment Symptoms. Using the drop-downs in the value fields, you need to answer the first 5 questions regarding your patient's symptoms. Notice that each answer you selected has a number value following it. Add each of the numbers and enter the total in the field for the ACT score. Use the drop-down next to asthma severity to describe your patient's status.
Okay, what do I need to do if my patient has COPD?
In HPI, for patients with COPD, you will need to answer questions regarding their current signs and symptoms at least once or more often as needed. Let me show you. From your progress note, click on HPI. Under the Total Health category, select 3.0 COPD. Click in the Notes field next to the signs and symptoms. Using the drop-down in the value field, answer the first question regarding whether the patient is having any signs or symptoms of COPD. The additional questions regarding cough, shortness of breath, and exacerbations are optional and can be answered if needed.
How do I order PFTs?
Annual PFTs are ordered under Labs. Let me demonstrate this for you. To order your PFT from the treatment window, click Browse next to Labs. In the lookup field, type PFT. Select the PFT lab option. You will need to specify the type of PFT needed. To do this, click on the ellipsis next to the PFT order. Now select the Add Notes button. You may free type the test needed or select Browse. In the Find field next to the keywords, type PFT and choose either PFT with DLCO, PFT Full Study, PFT Lung Volumes, or PFT Methylcholine Challenge. Click OK to close the windows. Fax the orders to the outpatient and pulmonary lab at MMOB or Patewood Lung Center office. If the patient goes to either of these locations, the results will be entered in the order as required. Note: offices that use Midmark for in-house barometry will continue to utilize the diagnostic and select the drop-down menu for the results. Please either select FEV1, FVC greater than or equal to 70%, or FEV1, FVC less than 70%. EHR support, how can I assist you?
Hi, I just completed education on asthma COPD documentation, and I have a couple of questions.
I would be glad to help you with those. What is your first question?
Is there a template for documenting my HPI?
Of course. Let me show you how to save them as favorites and apply to your note. From the File menu, select Templates. Use the Category drop-down to select a Total Health. Select Total Health Asthma 3.0 and click Add as Favorite. Do the same for Total Health COPD 3.0. Return to your progress note, and from the right chart panel, select the Templates tab. Click the blue arrow next to the template to add to your note.
that'll save some time for me. My next question is about alerts. Is there any type of alert that will notify me if something is due for the patient?
Yes, it's called a CDSS alert. You should view CDSS alerts each time your patient visits to see if specific care is due. To do this from your progress note, click on CDSS. The items in green indicate the patient is current and the alert has been met during the required time frame. Items listed in red are near or past the due date and should be completed during the visit.
CDSS alerts. I can remember to check there to see if anything is due. Speaking of checking it at every visit, can you remind me how often I need to complete each section?
Of course, remember pharmacologic therapy needs to be completed at each visit. Asthma assessment and smoking status should be documented every 12 months. COPD spirometry evaluations need to be completed at least once and or as needed. COPD bronchial dilator therapy should be completed anytime FEV1 FVC is less than 70% and symptoms present.
Okay, speaking of pharmacologic therapy and bronchodilator therapy, is there a preferred RX list?
Yes, if you look in the written documentation provided with the Asthma COPD outcome documentation course, you will find a list of preferred medications.
Thank you. I'll call back if I think of any more questions.
For questions regarding the information shown, contact the EHR support team via Bridge Access on GHSNet.